Hello, Navneet. Uh, this is great that you can come, be with us and talk about your health journey at the with the South Asian Heart Center. Tell us a little bit about yourself and why you came to the South Asian Heart Center.
Hi, Ashish, and thanks for the opportunity to talk to you about South Asian Heart Center. So, I got in touch with South Asian Heart Center personally about a year ago, but actually I've also introduced my parents who were visiting about a decade back, and also had gotten them looked at by the South Asian Heart Center. Basically, just like many Indians, I also have a family history, especially on the maternal side around diabetes and high cholesterol. And my own numbers, were creeping up on the A1C and the cholesterol. And I was approaching 50, so it seemed like an opportune time. So I had, reached out by myself, and also my, primary physician had advised it. So that's how actually I got in touch again, and I enrolled in the program. Yes, I think there were a few drivers for me to, approach the South Asian Heart Center and join the program. This program is of course called Stop D, Stop Diabetes. I was not diabetic myself, but my A1C numbers were creeping up. So one goal was to get them to the normal range. Also, the cholesterol numbers had been going up, so the same thought was there behind those two. The other thing I was interested in, I knew that the program is tuned towards sustainable long-term changes in lifestyle. So I also wanted to understand what are the different areas that I could change slowly, right, and get to a better spot than where I was about a year back.
So, Navneet, you joined the Stop D programs. Tell us a little bit about what happened along the way with the Stop D program and, just how you managed with it.
Sure, Ashish. So, I joined the program. I didn't know much about the program and what it would entail. How does it conducted? What are the sessions? So I joined and I realized, okay, it's actually a group, kind of a program where the participants are put into a cohort. It's almost like graduating from college, and we get together every week. There's actually a presentation. There's a coach assigned to us. We had a very fantastic coach from South Asian Arts Center, Leela, and then the coach then presents in that session, and it was very interesting. So the kind of information that was shared on diet, sleep, meditation, research-backed, longitudinal study-based information. A lot of it was eye-opening. So that was something, and quite a few of it was actually surprising. So there are many things I was not aware of. It was heartening to see that many of the recommendations coming in the program are based on long-term studies. So that was something which was a bit new. Second was, it's a group, so how much do people share? How comfortable do they get with each other? So that part was an unknown to me. We, of course, also had actually one-on-one sessions with the health coach, with Leela once a week, but the group settings were also once a week. It was a good journey. The group slowly opened up to each other. We also formed a WhatsApp group. We started encouraging each other. And in the sessions, Leela would like periodically stop, especially in the group sessions, and we would then talk amongst ourselves about what had we just, seen, or what are the slides or the video talking about, and what could we do in terms of changing things ourselves. And yeah, there were some moments where it was like, no, this is not for me. It's not going to happen, right? Whatever the recommendations are. And then after a few weeks or a couple of months, seeing other members make a change was very powerful and inspiring. So I was actually able to make quite a few changes, not just based on the coach and the information, but also the power of the group, especially in the first 3-4 months when we met.
Excellent. So, Navneet, tell us what specific changes you were able to make and what you attribute them to.
Yeah, I think the biggest change I would say, Ashish, was in just being very, not very, but becoming conscious about what I was eating, when I was eating. Was it nutritious? Was it healthy? And in the program, there is something called as a 9-inch plate method, and just being just a little bit more mindful about what you're eating and some small changes in those. Courtesy of the program, I lost about 15 pounds, and I attribute it completely to the recommendations made in the program, and also it was possible for me to make those changes. So that is been one of the biggest impact. It's full 1 year now, and my weight is still sustaining, at this 150 to 153 pound level, and it's because of the consciousness that I was able to bring into my diet. So diets that has been quite sustainable. And the other things where it has helped has been around the focus on exercise, different types, both cardio as well as strength, and the focus on meditation and sleep. I wouldn't say that, on those three aspects, I have kind of reached a sustainability level, but I was at least able to try quite a few of the suggestions and see for myself the benefit. So my goal actually is, interestingly, I'm enrolling again in the next year because I want to get to a sustainable level in the other facets.
Wow, Navneet, that was, it's a model kind of plan that you've created not only for yourself during the journey right now, but also the next steps, which is to continue working, with the South Asian Art Center in the next years of Stop D. Again, and few people do that. I mean, some people choose to kind of, not work the curriculum or just kind of do the coaching, etc. But that's a big step forward. Um, so, um, tell us a little bit more about those next steps and what you specifically want to achieve kind of going forward.
Yeah, so the diet is actually in a good spot right now. So I'm looking at the remaining three things in the program, which is diet, exercise, and meditation. And in order to do baby steps, so I'm working with my coach right now first on the exercise piece. How do I bring it in on a regular, sustained level? And once I get a handle of that, then she and I will discuss, is it meditation or is it sleep? I think for me, likely it'll be meditation first. My sleep has always been a challenge. So those are, some of the next steps I want to work with, my coach. And, the program has been, so we know that there's enough research now talking about that South Asians as a group, right? We are susceptible to, as an ethnic group, to early heart disease, and more so and as well as to diabetes, at a more prevalent level. And about 20, 30 years back, I wouldn't say there were any resources available. Whom do you talk to? Who can help out? And right now, when I look at the South Asian Heart Center, and I've seen it, a decade back, as I mentioned, my parents had taken them versus, what it is now. It's like a sea change. Now it's, I think, fantastic support. There are coaches, there is a community, there is a full-fledged longitudinal program, and there is support, even after the program. And there's like a community that is there now to help us, right? And it is open to everybody. So that actually is amazing to see. So I think anybody who is looking at sustainable changes in their lifestyle, especially of South Asian descent, but even otherwise, and they have a family history, I would highly encourage them to take advantage of the program and enjoy the community support that comes with it.
Thank you, Navneet. That was really well said. I look forward to kind of working with you as you move on for the next year. But thank you so much for your time today and for voicing kind of what you were able to do. And I know that you'd be a great example for all of our participants.
And actually, personally, thank you. I'm so glad you set this up. So it's really helping us. Yes.
All right. Thank you, Navneet.
Yeah.